the Laceration Course in partnership with EB Medicine. My name is Patrick O'Malley. I'm a board-certified emergency physician and creator of the Laceration Course. I completed my emergency medicine residency in Charlotte, North Carolina at Carolinas Medical Center, and for the past 15 years have worked in a variety of community emergency department and urgent care clinics. I'm on the board of directors for the College of Urgent Care Medicine and very excited to partner with EB Medicine to bring the Laceration Course to a wider audience. The current state of affairs in urgent care medicine is interesting. This recent article in the Journal of Urgent Care Medicine talks about acuity degradation and some of the factors involved in that. 15 years ago, urgent cares were staffed by physicians, about 70%. Most recently, that trend has changed quite a bit, and it's now 85% staffed by nurse practitioners and PAs. There are a lot of new graduates, many of whom who are coming out of school with not much clinical skills training and procedural training. It's a very tight labor market. You all know that better than I do. Competition for clinicians is very tight, and we are being forced to hire people who don't have a lot of clinical experience. It's also interesting to note that the number of patients who are going to urgent care with lacerations has dropped quite significantly. 15 years ago, it was about 1.42% of all visits to urgent care for laceration, and that's come down to about 0.55%. A lot of factors at play for that reason to be able to explain that, but one of the really significant factors there is the fact that a lot of patients are simply referred away from urgent care because of lacerations. There's also a lot of competition for patients, and if your clinic is not able to offer this service, patients are going to go somewhere that does. How they recommend, the authors of the article, what they recommend is that we need to increase scope of care, and that can be done through training, through education, and making sure that your team members have the not only the educational resources, but also the physical resources to be able to manage these patients and take care of them in your clinic. What happens when patients get referred away from your clinic to the emergency department or somewhere else when they have a laceration? Well, I can tell you from experience that it does happen quite frequently. I did a study myself with two other physicians where we called 100 clinics across the country and posed as a hypothetical patient with a lip laceration. 44% of the clinics that we called said no, that we needed to go somewhere else. You need to go to the emergency department. You have to see a plastic surgeon. Well, that does several things. One, it's a loss of revenue for that particular visit. It's also the loss of future business, and let me explain. When a patient comes in to you and they get referred away, they go to the emergency department, oftentimes going to be seen, evaluated, managed, and taken care of by a PA or a nurse practitioner or emergency physician. Plastic surgery does not get involved in these unless you are fortunate enough to be in a high-density plastic surgeon area. The next time they have an injury or even just a minor medical complaint, they may think twice about going back to your clinic because they were referred away on a previous visit. It leads to a loss of trust. Patients are not happy about this, and it really comes down to a lack of confidence and training. And I am here to assure you that your clinicians and your clinic can, in fact, take care of the majority of lacerations that are walking through your doors. That's where the Laceration Course comes in. The course is a comprehensive overview of everything that is needed to be able to safely and confidently manage lacerations. This course comes from my 3 years of residency training and 15 years of working largely in single coverage emergency departments without plastic surgery or specialist backup. And I have been forced myself to learn these skills, and that's what I pass along to anyone who takes this course so that they can get the benefit of all the patients that I've taken care of and managed, the research that I've done to put this course together. It's got 13 lectures, 10 hours of content, Everything is available online, asynchronous learning. It can be watched at any time. The slides are downloadable. They can be printed off for the learner to take notes on. The audio for each lecture can be downloaded so that they can listen on the go. We can even arrange for notifications of completion of each module or the entire course to be sent to the medical director so that you know that your team members are going through the content and taking the course. We can also arrange for practice suture kits to be sent to your clinics so that your members can practice their suture techniques and hone their skills. This is a list of all the modules. I'm not going to go through and read all of these to you one by one, but the things that make this course unique and make it so special and impactful are a heavy emphasis on the soft skills that we're all supposed to know, but we never get taught. Things like procedure notes, proper documentation. There's a dedicated lecture to billing and coding so that you are getting reimbursed properly. You're not leaving money on the table because of improper or lackadaisical documentation of what the person is doing in terms of a repair. We've got an 80-minute discussion with an attorney who is also an emergency physician, Bill Sullivan. He lays out from the horse's mouth, directly from the attorney, what we need to be mindful of, what we need to be on the lookout for, essential components of your documentation, injuries that simply cannot be missed, and how to reduce your medico-legal risk and your medico-legal exposure. So those two lectures alone allow the course to be paid for itself. I've got 12 case presentations that are placed throughout the entire lecture series. And I put those in there to really explore and open your eyes to the medical decision-making process involved with taking care of patients with lacerations. So there's a dedicated lecture on facial and finger injuries. Those are the ones that really seem to cause the most anxiety in an urgent care perspective and lead to a lot of unnecessary transfers to the emergency department. So I really want to go in and talk about all aspects of wound care, but those are the things that really make this course unique and special. When putting this course together, I had several goals. I wanted to standardize the approach to laceration so that everyone working in your clinic is on the same page. Whenever a patient walks into your clinic, they should be able to receive the same level of care. And that's what this course allows. I integrate evidence-based practices throughout this course. The course is heavily referenced. There are probably more than 50 additional hyperlinks that can be clicked on and take your clinicians to even further deeper reading if they want to follow that. We want to improve efficiency by implementing practical recommendations, things like switching from sterile gloves to clean gloves, utilizing tap water, really talking about how to get the clinician thinking 2 and 3 and 4 steps ahead so that they can be efficient, and that when a patient with a laceration comes in, it doesn't bog the clinic and bring everything to a standstill. This course can easily be integrated into training and the onboarding process. I want to free up medical director, chief medical officer, and educator time so that they can focus on other things. This course can really make your life as medical director much, much easier. Because let's be honest, you've got somebody that you're working with. They may have to shadow you for X number of shifts. How likely is it that they're going to get such a wide variety of lacerations coming in to be seen while you're working with that one individual person? This course really gives exposure to a wide variety of injuries and things that they are going to encounter, and it's all in one place. Practical applications for the course. I mentioned some of those in the previous slide. Really, taking a closer look at the resources that you have and how some of these can save money. Switching from sterile gloves to clean gloves, sterile water to tap water. the importance of quality instruments, a lot of efficiency tips, and a lot of recommendations for must-have products and tools so that your team members can safely manage these patients and not refer them out just because they don't have some of the proper resources needed. We also want you to be able to look at outcomes. Increasing clinician confidence is a big one. There is nothing that is more uncomfortable than when you are when you're expected to do something clinically that you may not have done before or that you may not feel comfortable with. And that's a benefit of this course. There's just such significant exposure to a wide variety of clinical presentations and things that they are going to see, and to raise that confidence level so that they can see those patients and keep them in-house. As mentioned earlier, reducing your medico-legal risk and exposure. We want to improve the billing and coding so that you can be properly reimbursed. And it really just comes down to knowing what to include in the documentation so that you can be reimbursed properly. Improving efficiency, some of the things that I talked about earlier, but the case presentations that I have throughout the course really talk a lot about this. So as soon as you see the patient, what is it that should start going through your mind so that you can start preparing and improving that efficiency to be able to get that patient in and out in a timely manner. We want to prevent unnecessary transfers for all of these reasons, things that we talked about earlier. Make sure that those patients know that they can come to you for anything that they need. And all of these things lead to a better patient experience. We want our patients to feel as though your providers are competent and confident and can take care of them so that they know that they can come back to you in the future for whatever their medical needs are. Here's just a slide that we put together to look at some of the potential cost savings from implementing the laceration course. Again, switching from sterile gloves to clean gloves, from sterile water to tap water. I think the biggest thing here, though, is when patients get referred away, the loss of revenue for that particular visit, but also for the billing and coding. We all know that clinicians in all specialties are prone to undercoding. So implementing the recommendations and the best practices from a documentation standpoint can really lead to a significant revenue capture by implementing these proper billing and coding recommendations. Medical director time. How much time are you spending as a medical director or chief medical officer dealing with this type of thing? I want to be able to take the time that you are spending educating and with your new clinicians on laceration education so that you can spend that time elsewhere. So you may ask yourself, who is this course for? We've got seasoned clinicians. They've been working for a while. Do they really need this course? Well, the answer is yes. Just because we've been doing something for a long time does not mean that we've been doing it right. Obviously, the course will benefit your recent graduates, your new hires, people who are working in urgent care for the first time. But as you can see from some of the comments here, the course benefits everyone. I spend a lot of time in the course going through bad practice habits, myths that have been perpetuated, things like using epinephrine in fingers. You can't safely do that. The sterile gloves thing that I've mentioned earlier. So there's a lot of information that even seasoned clinicians will benefit greatly from. As mentioned earlier, the billing and coding and the medico-legal aspects of laceration management, everybody can benefit from those. You can probably tell that I'm a little bit passionate about this and would love to work with you and your group and your clinicians to help them gain the confidence that they need to be able to take care of these patients and keep them in your clinic. So together we can elevate the quality of care and the scope of practice that we're offering in urgent care. Here's my contact information along with Stephanie Williford, CEO of EB Medicine. Don't hesitate to reach out. Please let us know if you have any questions. Look forward to working with you.